It should be possible to make it more appealing to offer coverage than pay a fine. In conclusion, it is important to realize that the Affordable Care Act's main goal is to reduce the cost of health insurance while ensuring that all Americans have a chance at excellent quality care. While there remains uninsured individuals after 5 years, no visible reduction of healthcare premium costs, a little more time is needed before we see the results. Not all the aspects of the ACA have been implemented yet. Over the next 3 years, we may see more pieces of the puzzle fall into place. Once that happens, it should be possible to see the number of uninsured decline and the cost of premiums decrease as well. While the Affordable Care Act is law, changes need to be passed legally or they will hold no ground. The same goes for expanding the funding for the ACA. It must be passed legally. It is the duty of the United States government to ensure that we fulfill our promise of affordable health care and health care insurance for everyone. Without this, there is no point of having passed the ACA. We have a duty to ensure the passage of policy development so the improvement of health care can be realized. So a brief synopsis of the 10 essential services is, firstly, the ACA is solving common community health problems by setting goal plans with coverage of millions of Americans, including families, employees, and Medicare, Medicaid beneficiaries. Secondly, the ACA is helping people with pre-existing conditions by guaranteeing coverage by not letting their premiums vary based on their gender or medical history. Third, today's health issues include 36 million deaths each year that are caused by non-communicable diseases, such as cardiovascular disease, cancer, diabetes, and chronic lung diseases. Fourth, solving healthcare issues by covering 70% of healthcare expenses. This is allowing people to have the proper care they need in order to better their health needs. Fifth, developing plans for many individuals and families by allowing them to purchase health insurance that best fits their needs. Enforcing laws such as children being able to stay on their parents' insurance until the age of 26. Another law stating that insurance companies will not be allowed to drop coverage whenever a person gets sick, known as rescission. A third law stating that most individuals' businesses will be required to provide coverage to their employees, as well as individuals being required to get coverage themselves or they will be fined. Seventh, covering pre-existing conditions, businesses having to cover their employees. People participating in the program must pay premiums for 5 years in order to be eligible to collect benefits, help paying for long-term costs with the elderly as well as people with disabilities. Some references. And final references.